Welcome to this NETRIN liver inflammation project. Chronic liver disease affects 1 to 2 billion people worldwide and represents a major risk for the development of HCC, which is itself the near mandatory gateway for the development of hepatocellular carcinoma. CLD stems from a diversity of etiologies, mainly ranging from viral infection to non-alcoholic steatohepatitis to alcoholic liver disease and to autoimmune hepatitis. Although patients with chronic viral hepatitis have benefited from treatment improvements, concomitant increase in the prevalence of NASH in the last 10 years, a phenomenon that is expected to expand in the next decades, predicts a sustained surge in the public health burden related to CLD and ultimately also HCC. Interestingly, through distinct means, these etiologies converge towards chronic inflammation of the liver, which is a common histological and functional hallmark of all CLD patients. Inflammation drives the accumulation of extracellular matrix, leading to fibrosis and cirrhosis, which is the major gateway to HCC onset. Importantly, most of the precited etiology determine forms of CLD that are resistant to anti-inflammatory drugs, prompting for the identification of novel players as possible novel targets. Now we are going to talk about NETRIN-1, which is the main target of the project. NETRIN-1 is a secreted developmental protein endowed with anti-apoptotic properties and re-expressed in numerous cancer types, of which several derive from inflammatory conditions. It is normally repressed in adulthood, yet we have gathered several preliminary datasets pertaining to viral infection, UPR, and inflammation per se, where NETRIN is reinduced. These datasets support the notion that NETRIN-1 re-expression in CLD may be deleterious for disease progression. With Benjamin Gibert, Patrick Mellen, and the use of an antibody derived from NETRIS pharma activity, we have also demonstrated that the clinically used anti-NETRIN antibody named NP137 displayed the ability to reverse acute hepatic inflammation unleashed in 3 different mouse models triggered by viral and bacterial motifs. Acute and chronic inflammation differ by their kinetics of inflammatory surges, by their synchronization across hepatic areas, and by their distinct sensitivities to treatments and pharmacodynamics. We can have in mind, for example, the case of short or long-term administration of corticoids and metabolic side effects. In this project, we wish to mitigate or reverse liver inflammation with this NETRIN targeting antibody in metabolic and viral-like models of the process. Our primary endpoints are the values or the scores of the soluble markers of inflammation, of the cellular effectors of inflammation, and of cellular pathology markers that are pertinent to the liver. Our goals are therefore to preclinically evaluate the ability of this approach to interfere with inflammation in pertinent mouse models of CLD in a chronic setting, and to characterize CLD in these in vivo samples in which NETRIN-1 has been depleted. This project should help identify NETRIN-1 regulated factors implicated in chronic inflammation of the organ, and the project should also provide tolerance data related to the use of the NP137 antibody in vivo in the context of a damaged liver. Thank you very much for your attention.